Good day, everyone. My name is Audrey Beatrice Anakais, and I'm currently pursuing my bachelor in environmental health and safety. A warm greetings to our lecturer, Mr. Pancha, and thank you for this opportunity to share my individual presentations. So today I will be talking about something very important and very real. Is Malaysia prepared for the next major disease outbreaks? We all remember how hard the COVID-19 pandemic hit Malaysia. And since then, many things have been improved, especially in technologies and vaccination efforts. But are we fully ready for another big outbreak? My answer is not yet. So Malaysia still have major challenge in four areas. So the first one is the healthcare system capacity. The second one is the emergency coordination. So the third one is public health literacy. And the fourth one is the mental health support. These areas highlight the ongoing challenge that need addressing for Malaysia for we truly be prepared for the next major disease outbreak. So during the COVID-19 peak in 2021, hospitals like HKL, Hospital Kuala Lumpur, were overwhelmed. Even some patient were turned away. The World Bank in 2022 reported that Malaysia has just 3.0 hospital beds per thousand people, which is well below the average in developed countries. In rural areas, also have fewer medical specialists. If another outbreak hits, the system may not cope. That's why Malaysia urgently needs more ICU beds, more trained staff, and better access in rural health clinics. Sorry. Next, we look at emergency coordinations. During the Movement Control Order (MCO), we saw inconsistent rules between state and federal levels. This create frustrations and confusions among the public. A study by Hashim and colleagues in 2021 found that although the CPRC acted quickly, the lack of consistent standard operational procedure (SOPs) reduced the overall impact. This shows that even with fast action, poor communication between agencies weakens our national response. Malaysia's experience underscore the needs for transparent, coordinated communication and leadership to effectively manage health crisis and maintain public trust. So the third issue is misinformation. A 2020 Ministry of Health survey found that 39% of Malaysians rely on social media for health information. This led to many people believing myths like home remedies could cure COVID-19 or being afraid for vaccines. Without better public educations, especially in rural communities, false information will continue to spread faster than the truth. Mental health often gets overlooked, even though it's just as important as physical health. During the pandemic, many people, especially those in the B40 income group, had no access to counseling or emotional supports. The World Health Organizations the World Health Organization recommends at least one psychiatrist per 10,000 people, but Malaysia falls short, especially in rural and underserved areas. To conclude, Malaysia is partially prepared but not fully. Serious gaps still exist. Let me quickly recap the four key issues. So the first one is limited healthcare capacity. Second is poor emergency coordination. The third one is the spread of misinformation, and the fourth is lack of mental health support. To protect our people, we must act early and not after the next outbreak begins. Because the next major outbreak is not a question of if, but a question of when. That's all from me. Thank you so much for listening. I hope my presentation has given you something meaningful to think about. And once again, thank you, Mr. Pancha, for your time and guidance. That's all. Bye.